Okay, so welcome to Grand Rounds for today, the last Grand Rounds in November. Today we are honored to have Dr. Melanie Bechard present, but we'd like to start with our land acknowledgement. So Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. CHEO also honors all First Nations, Inuit, and Métis peoples and their valuable past, present, and future contributions to this land. So today we have Dr. Melanie Bechard, and there was an issue with SharePoint, so I didn't actually get a bio because of Rachel and I fighting with SharePoint. So I Googled. But I think I came up with a pretty good bio from the Google search engine. So Dr. Bechard received her medical degree from the University of Toronto in 2015, and then completed a residency at the Hospital for Sick Children in 2018, and then completed her Pediatric Emergency Medicine Fellowship at CHEO with us in 2020. And then she went on to go to Johns Hopkins Bloomberg School of Public Health and received a Master's of Public Health degree. And then she joined as a physician, emergency physician at CHEO and assistant professor at the University of Ottawa since 2021. Google also tells me she is a certified yoga instructor, and she currently serves as chair of the Canadian Doctors for Medicare. And so we are very excited to have her present to us today. And her title of her presentation is Postal Code or Genetic Code, the Built Environment's Impact on Child Health. Welcome, Dr. Bechard.
Thank you, Dr. Johnston. That was such a thorough and unsettling and totally accurate bio. So maybe I need to be careful with what I put online a little bit more. So let's get into it. Whoops. I have no conflicts of interest. I just make enough to provide a good life for my chinchillas. I recognize not everyone likes rodents, so if you're disgusted by their sweet little faces, this is their only picture, but I couldn't resist at least one. However, I do have some disclaimers. One is that this is an evidence-based presentation, but there's a lot of passion because I cycle for almost all of my transportation and I don't want to die on the roads, and I also don't want other people to die as well. So I do hope that that passion is not a turnoff to anyone. I also recognize that we're focusing on children's health. It's our mission at CHEO, but a lot of studies also relate to adults, and I do believe that what's good for adults is good for kids. Next up, I want to recognize that the most important factor of someone's environment and where they live is really their income. And there's a lot of inequities and environmental justice to consider here. So by no means am I shaming any environments or neighborhoods or lifestyles. I just like to provide people with information so that we can advocate so that every neighborhood provides people with an equal chance to thrive and be healthy. Also, health is political, so there are some aspects that will touch upon things that are currently being debated at Ottawa City Hall and in city halls across the country. That's okay. This is a nonpartisan presentation. Vote for who you want. But I do hope that today's presentation at least motivates you to vote, because so much of our day-to-day lives are actually affected by some of these municipal policies. And last but not least, the built environment is so important, but don't fret if you feel like your environment is not as conducive as to your health that you would like. I think the most important thing for children and adults is just coming from a happy, supportive home. But why am I talking about the built environment today? So this is what I like to affectionately call my real office, where I spend a decent amount of time. And this past spring, I was working a shift in the ED, and in one shift treated 3 children who had been hit by cars. This was just too much for me. I think something broke inside a little bit that day. Thankfully, 2 of the children had relatively minor injuries. One had a subdural hematoma and she healed up just fine. But it did frustrate me to no end because these are preventable tragedies. And it made me reflect as well on the aspects of our environment that both facilitate and prevent things like this from happening. I also reflected on how I've had multiple instances where kids have come in with recurrent asthma exacerbations and parents have told me, look, we're in social housing, there's mold, we're in an apartment, our neighbor's smoking next door, how am I supposed to keep my kid healthy? And there's so few mechanisms for me to be able to do that and support them. So that's what motivated me to want to talk about the built environment today. We're going to discuss the impact on children's health, everything from injury prevention to physical activity to mental health. I have 90 slides. We're probably not going to get through it all, but when I get excited, I talk quick. So I wanted to over prepare with content. There will be ways to advocate for evidence-based improvements in the built environment, kind of hinted at throughout. And last but not least, we're going to learn how to ride a bike in the winter if you are so motivated by the end of this presentation. So first, what is a built environment? The basic definition is that it's the human-made design and layout of the communities in which people live, work, and play. A lot of it can be attributed to the buildings around us, but I think a broader and better definition of the built environment are a lot of the intangible aspects too. Noise, air pollution, the social connectedness and relationships between people in the community. All of this can have a huge impact on our health and is inextricably linked to the actual infrastructure and buildings around us. So first off, let's talk about injury prevention. Man, even my slides are sleepy today. There's a delay in changing them. So this was an interesting study published in the Canadian Journal of Surgery that looked at these different mechanisms of injury. And they assigned an injury prevention priority score to each one of them based on their frequency, their severity, mortality, the amount of healthcare resources they used, and the potential years of life lost. And we can see that number one, falls came up. Now, this is largely from adults and older adults, still relevant for pediatrics, but more peripherally related to the built environment, self-harm as well. But one aspect that comes up fairly high is preventing drowning and submersions. And this is an area that I wanted to focus on because there's relatively simple built environment fix to help prevent this. Some of you might have heard of four-sided pool fencing laws. These laws stipulate that you need a fence around four sides of the pool, as opposed to the traditional three-sided fencing laws, where it's okay to have a fence around three sides of the pool, where that fourth side becomes the wall of the house. The problem with this approach is that it prevents other children from wandering into the property and falling into the pool, but it doesn't prevent the kids from the home from wandering into the pool and falling in, which is probably a higher risk situation rather than kids hopping fences between yards. So four-sided pool fencing has actually been studied in a Cochrane review about 20 years ago, and they found that four-sided fencing laws reduced the risk or the odds of child drowning by about 80%, and this was significant through 3 different case control studies. Now you might be wondering, oh, okay, sounds fairly straightforward. What's going on in Ottawa? We currently don't have a four-sided fencing pool law in Ottawa. It is okay to use part of that fence as a wall or other structure. This was debated in the City Council in 2012, but there's a lot of opposition from the community and from certain councillors who did not want to implement this law. They reevaluated it in 2015, and instead of revising it to say that we needed four-sided pool fencing, they simply stipulated that the gate around the pool needs to have a lock. And I was mostly just shocked that that was not a requirement beforehand. So that's a simple intervention to help reduce drowning and submersion for pediatric patients. But if we look at these injury priorities, you'll notice a lot of them are related to transportation. And we're going to focus a lot on the transportation aspect of the built environment today. Because in our day-to-day lives, the most dangerous thing we do is getting from point A to point B. So for those who are currently commuting en route to work, please be safe. I don't want to make you nervous during your commute. You'll be a-okay. It's just statistically something that we need to consider. And unfortunately, this year in Ottawa, we've already seen that there have been 11 pedestrian deaths. Now, I know we have a lot of academic and research-oriented people here, and you're probably having questions like, oh, that number sounds terrible, but how does it compare to other regions? How does it compare to other years? Is this a particularly bad year? Is Ottawa a particularly high-risk place? Well, I also had some of those same questions. So I went to the source, the Ontario Road Safety Annual Report. I looked at numbers from 2019 because 2020 was an off year for pedestrian collisions because there obviously wasn't as much people driving. And unfortunately, we don't have the updated reports from 2021 and beyond just yet. But if we look at 2019, across the x-axis, I have all the different cities, municipalities in the province, and the number of collisions per 1,000 registered vehicles. So this is geared towards the population. Now your eyes might be scanning, trying to find where Ottawa is. We are right here. So if you look at this chart, we can see that the number of collisions per 1,000 registered vehicles in Ottawa are the 3rd highest in the province. We're only surpassed by Middlesex and Toronto. So this does suggest to me that we are disproportionately in a position of danger here in Ottawa, and we need to do something about it. One policy mechanism that can help prevent injury is taking a vision zero approach. This basically says that the only acceptable number of serious injuries and deaths on our roads is zero. And it recognizes that these are not accidents. I really try to refrain from saying motor vehicle accidents or MVA because it can be prevented, which is very tragic and very frustrating. When we look at the hierarchy of controls, just like for infection control, it also applies to injury prevention on our roads and eliminating the hazards or substituting them, basically separating people away from vehicles are more effective than focusing on pedestrian or driver education. And at the very bottom of this period, if we could put like an exclamation point dot underneath, I think there'd be this control. Don't be distracted by how cute and happy this child looks. This is an actual intervention that's been piloted in cities across the United States, maybe some in Canada, but I haven't found data, where there's these holsters of flags at either end of an intersection, and pedestrians are somehow supposed to reach up and grab the flag. Forget if you're using a mobility aid or in a wheelchair. I don't know how you'd even reach that. And then you're supposed to wave the flag as you cross the street saying, hey, please don't kill me. So perhaps unsurprisingly, cities like Berkeley and Seattle studied this, found that it was not effective at changing driver behavior. People did not slow down. They did not necessarily come to more complete stops. There was no change in injury risk to pedestrians. And also people kept stealing the flags because honestly, why wouldn't you? So if we look at more effective implementation of injury prevention in the built environment, Vision Zero was actually piloted by Sweden back in 1997. And over the subsequent 15 or so years, traffic deaths in the country fell by 68%. And it's now one of the safest places to be a cyclist or pedestrian in the world. Other cities across the world have adopted this, including Edmonton, which was the first Canadian city in 2015. And since then, they've been able to reduce traffic deaths by 50% and serious injuries by 32%. So the skeptics among you might say, wow, those are impressive statistics, but Mel, it's still not zero. This vision zero is truly not attainable. We just have to accept that part of the cost of modern society is that some collisions will occasionally happen. And I would agree with you if Oslo and Helsinki didn't already prove us wrong. So these cities actually achieved Vision Zero in 2019. The city of Oslo, which has 680,000 people, did not record a single pedestrian death within the city throughout the entire year. And what's perhaps even more impressive is that throughout the entire country of Norway that year, there was not a motor vehicle collision death for a person under the age of 16. So we'll talk about how Oslo and Norway at large achieved some of these really amazing effects. But first, I wanted to pause for a little bit, gives me a chance to rehydrate and gives everyone a chance here to interact. So how might we prevent serious injuries and fatalities from road traffic? Feel free to either unmute yourselves or raise your hand or just type in the chat. What are some initiatives that you've heard of? And if anyone suggests waving the pedestrian flags, I will be so sad.
Crossing guards at schools.
Yeah, crossing guards. Thanks, Stuart. I was actually surprised to learn crossing guards also help. Oh, I just learned Halifax has the flags. Crossing guards also help adults cross the road. There is a school near my house and the crossing guard helps me. Oh, look at Alex engaging in some active transportation.
I'm wearing my helmet while I'm driving in, Mel. It's the first step. No, I'm just joking. Biking in, we should all, biking is, I follow Curtis Lavau's sort of model of biking in all weathers.
I love it. I love it. We're going to cover that soon. Agreed. Modal shifts to safer methods of transportation like biking, walking, public transit, eliminating slip lanes. Absolutely. Slip lanes where you kind of automatically turn off the road are really dangerous. Your nephew loves the flags. I could see how they'd be fun for kids too. And Pranesh biked in. Oh my gosh, you guys are after my own heart. Yes, Roger, dedicated bike lanes with solid dividers. A constant saying that I've seen is that paint is not infrastructure. And apparently there's some studies that suggest that when you have just a painted bike lane, drivers actually get closer to the cyclists, as opposed to if there was just no paint whatsoever. When there's no paint, drivers have to kind of use their intuition and judgment to give a wider berth for cyclists. But with the paint, they just say, oh, I'm in the lines, I'm fine. And it is pretty scary sometimes. Pedestrian bridges, especially for busy roads. Yes, absolutely. Eliminate the conflict. Great comment, Valeria. Yeah, I love all these ideas, you guys. If only we could form the Transportation Committee of Council right now. So these are some things that Oslo has done. They've changed their infrastructure a fair bit, but none of the things that really helped in Oslo were mentioned by us just now. These are not going to be popular, I think, with a lot of people, but this is the cost of what it took to achieve Vision Zero in the city. So Oslo put a 70% increase in tolls just for driving in the city, which did decrease traffic by 6%. It's a decent amount, I guess. They increased parking fees by 50%, removed thousands of parking spots, and also put in 35 miles of new bike lanes. And they set very strict speed limits around schools, or just prevented cars from being around school zones in general. Basically, they made it suck to drive in Oslo. And as much as this can inconvenience drivers, this is sometimes what it takes to have safer roads. And what is really cool is that when you introduce this modal shift, when you get people to bike or take public transit as opposed to driving, that means that there's fewer cars on the road, and that actually is a solution for less traffic. So paradoxically, this can actually make the commute a little easier for those who still really do need to drive. Yeah, and Rogers commented functional public transportation. This is something that Ottawa could really improve upon. So we talked a lot about Oslo's Vision Zero, and I know that we're all evidence-minded people, but stories and pictures can move us a lot more than just statistics. So I was wondering, what is it actually like to move around the city of Oslo? And for you, my CHEO friends, I spared no expense. I went to Oslo in the spring, did a little bike tour, and I've got a 30-second clip here that we can watch together. You might be able to hear the sound. If not, it's not a big deal. It's mostly just me telling my husband to be careful so that I don't crash into him. And as I play the video, feel free to take a look and see what you notice. All right, so that's basically it. So I'll pause now if people want to unmute themselves or comment. What did you notice there? Someone commented biking against traffic for the first part. Yeah, so we were mixing in with traffic. Thankfully, it was going very, very slowly. Stuart?
And signals.
Yes, yeah, we did some hand signals to try and be safe and indicate where we're going. One thing that struck me, and I know this is really hard to tell from the video, but as soon as I got off the train in Oslo, was how quiet the city was, especially for a big city. And it just made me realize how noisy our traffic tends to be. And also, there's not a lot of cars here. This is right downtown, Maid city center area. And if you compare the number of people who are walking or cycling compared to the number of vehicles that we saw, it really is a disproportionate amount. Yeah, and Magda mentioned no parking. What's also interesting too is that Oslo took the main thoroughfare roads, kind of like our equivalent, I guess, of like the 417 or a larger arterial road, and put them underground. So there's a lot of underground highways and tunnels going around the city, which makes it a lot nicer to live on top of the city. There's so many other little infrastructure improvements that I noticed in Oslo. Whoops. This is me just being a total nerd and posing with this little bicycle repair station. It had a pump, it had all these different tools. We do have something like this in Lansdowne right now, but as you can see, this is just a really tiny side street. There wasn't even anything in this building. So the fact that these were just littered throughout the city was amazing. And yes, this was my honeymoon and it was very romantic. And thank you to my husband for allowing me to just explore infrastructure. Now, another way to decrease injuries, in addition to just removing vehicles from pedestrians, is slowing them down. So if we look on the x-axis here, we can see the speed of the vehicle and then the probability of either death in orange or serious injury in blue on the y-axis. If a car is going about 30 kilometers an hour, the risk of death is about 5%, which is still kind of surprisingly high. But if that car strikes someone and they're going, let's say, 70 kilometers an hour, that risk of death is around 70%, risk of serious injury upwards of 90%. So the speed really does impact things. And I also occasionally drive a car. I know it's very frustrating to go slowly, but I also don't want to wake up and murder anyone. I'm sure that nobody here does either. And the cost of driving slowly is an inconvenience to me, but it could really save somebody else's life. So I do try to remind myself of that when I'm going frustratingly slowly. Municipal speed cameras are actually an evidence-based way to slow down drivers. What's really cool is that they can also slow down vehicles in other areas where there's not cameras, I think just because it keeps people on their toes. There's more specific infrastructure improvements that can reduce injuries and deaths of pedestrians. These curb radius reductions and curb extensions can improve driver visibility when they're turning. Things like chicanes, which is basically making the road not straight or putting obstacles in the way, force drivers to slow and pay attention. Same thing with curb extensions as well. There was an interesting study that was done in Toronto back in 2017 to 2019 that looked at implementing combinations of these 5 different interventions in 35 school areas, and had a comparison to 45 school areas that did not have these interventions implemented. And they did find that their combined effect did decrease the amount of drivers that were speeding from 44% to 40%, which was significant, but to me still seems really high in terms of speeding in a school zone. And there was a slight trend towards increased active transportation. So not a huge effect, but if we look at these actual interventions, they're nothing as dramatic as completely changing the curb. They're fairly basic, some extra paint on the road, some extra signs and beacons. So they do seem like something that could be achievable for a relatively low budget. If we're wondering which intervention is the most effective when it comes to changing the environment, narrow streets tend to be most protective against preventing pedestrian deaths, just because they really do force drivers to slow down, pay attention. Now, when we think of physics, there's force equals mass times acceleration. And acceleration is speed, and we want to reduce the speed to reduce the force. The other thing is to reduce the mass. And unfortunately, vehicles are getting heavier and heavier these days. So heavier vehicles are more dangerous to pedestrians, particularly children, because they're tiny. And the design of vehicles themselves can be quite dangerous as well. So SUVs in particular, or trucks that seat the driver up high, tend to be preferred by people driving because you can see far in the distance, but it significantly limits your visibility around the car. So this picture is showing the blind spot in front of this SUV. And you've got like a whole almost kindergarten class of children in the blind spot here. So you can see how this could be extremely dangerous for children or even adult humans who are wandering throughout the city. The other issue with vehicles like SUVs and trucks is that they tend to have a very blunt front end, so that if there is a collision, it tends to hit the vital organs, and the person is at risk of going underneath the vehicle, which obviously is very serious. As opposed to sedans or vehicles with kind of a lower front end, where typically the legs are hit. This is still very dangerous, but of course less deadly than hitting your vital organs and falling underneath the vehicle. So a study done in the state of Illinois found that children were 8 times more likely to die if struck by an SUV versus a sedan. They found that SUVs and trucks constituted 22% of collisions, but 44% of fatalities. So they are truly quite deadly for those around us. And then this sobering statistic is from a CBC News article where 8,000 pedestrians over this 20-year period could have survived if they were struck by sedans instead of SUVs or trucks. Obviously, drive what you want. I'm not saying not to drive an SUV or truck. I just think if you've got the opportunity and you've got the resources, choosing a smaller vehicle is safer for those around you. Now, if you're someone who's really Machiavellian and is more concerned with your own safety or the safety of your family, I get it. There is some evidence suggesting that SUVs could actually potentially be a bit risky even for those within them because they have such a high center of gravity. They're much more likely to roll over in a collision. So I think they do create a bit of an illusion of safety sometimes. We have to be quite careful with those. And then I just see a comment from Heather here, fines from speed cameras should fund active transportation infrastructure. Absolutely. We always say there's no money for active transportation infrastructure, which, as we'll discuss later, is a bit of an illusion. So that's most of what I wanted to cover for injury prevention. Are there any other comments or questions? Sweet. Keep the comments coming, folks, either in person, live, or via the chat. Next up is physical activity. I'm going to fly through this because I think it does intuitively make sense and the evidence is in line with that. Having a built environment that allows you to move about safely and encourages active transportation does result in you being more physically active. This was a systematic review and meta-analysis finding that when children live close to bike lanes, they have 50% higher odds of being physically active, which makes absolute sense. And now one might say, maybe the more physically active families choose to live near bike lanes, maybe it's more of a correlation rather than causation. But this study looked at infrastructure and street improvements for 600 children in New Jersey. And they found that as the infrastructure improvements were implemented, children actually became more physically active. So the number of days per week that they got the 60 minutes of recommended physical activity increased by about 0.4 days, which was slightly significant. Active transportation to school has been shown to increase fitness. There is a systematic review and meta-analysis published in 2021 of 68 studies looking at active transportation to school that found that it increased the amount of time spent physically active, of course. And cycling in particular increased your cardiovascular fitness, both in metrics like VO2 max and in the shuttle run test. When they looked at the effects on actual weight and BMI and body composition and skin folds, some studies showed an effect, others didn't. But truly, I think this is a less important metric. I think we do recognize that kids and adults can be healthy regardless of different body sizes. So increasing the physical fitness and increasing the time spent active is going to be good for their physical and mental health regardless. Next up, we've got mental health and cognitive function. So here, time to place your bets. I don't know, I really love betting and wagering, never for money, just for academics. Of 38 countries listed in the UNICEF Child Wellbeing Report, where does Canada rank for child well-being? $25. Good guess, Heather. 42. Stuart thinks we're below the barrow. Nancy's thinking 29. Christine 31. Oh, you guys are excellent. And then I just see here for Rasheen coming from Europe that sidewalks are optional in North America. Oh my goodness. Yes, it is a problem. It is like the most basic pedestrian infrastructure for safety, and it is frustrating we don't have it. I do have some analyses in Ottawa for sidewalk networks per neighborhood that I'll get into. So let me show where we rank on this UNICEF ranking of child well-being. This is a top third. You can see that number one, blowing everyone else out of the water, is Netherlands. So children tend to excel both mentally, physically, and in terms of their academics and skill building. The second third, we also don't see Canada there. There's other countries listed. And then right here, Canada ranked 30th. And I believe this was the 2019-2020 edition of the UNICEF Child Wellbeing Report. So what are we doing wrong? This graphic from the report kind of shows all the different factors that can impact child well-being. And you can see how so many of them could be impacted by the built environment, your household, your school, your neighborhood, the environment at large, and the climate. So I have a few slides next from the Dutch Cycling Embassy, because the Netherlands has really held on to the statistic that they have the happiest kids in the world. And nobody really knows why. There's so many different confounds and factors. But one popular theory from different sources is potentially the fact that cycling is so ingrained in the culture there. So the majority of children in the Netherlands will walk or cycle to school, and apparently they're clocking 2,000 kilometers per year, which is pretty impressive. They do have the safest streets in the world, so I can imagine that a lot of us would be more likely to walk or cycle to school or to work if we actually felt safe in doing so. Unfortunately, they don't have Canada as a comparison here, but we're probably fairly similar to the United States in terms of the pedestrian and cyclist fatality per 1 million kilometers. And this is really a sobering statistic. If the US had the same improvements in traffic safety as the Netherlands, 22,000 fewer Americans would have died in 2015, just in a single year, again suggesting that these tragedies are preventable. One really cool thing about the active transport to school is the increased physical activity. Canada was unnecessarily called out here, saying that we really don't get enough physical exercise each day. And this is an easy way to build it in. Another benefit too is that it gives the kids a lot more independence and gives the parents more independence. Thinking back to when I was a teenager, my parents basically had a part-time job of driving me around to activities because there's no other way for me to get there before I had a license. And this really frees up the time that the parents are allowed to pursue their own hobbies and interests and don't necessarily need to chauffeur around their children as much because children will get to and from their activities so frequently independently, either through functional public transport or through cycling. Now, some skeptics will look at this and say, okay, yes, but Netherlands has always been like that. It's very flat. Amsterdam's always had this cycling culture. This is a picture of Amsterdam in the 1970s. It was not always this way. This was a conscious choice that they made because they realized that there is an unacceptable number of people, particularly children, dying on the roads. And an oil crisis also forced them to look into more sustainable methods of transportation. I think both of these circumstances are happening to us in Canada right now. So we also have no excuse for moving forward. Yeah, and then I see Kaylee asking where are their helmets. Oh my gosh, this is such a controversial area of research. I'm a helmet girly. I love helmets. I think why not protect your brain? There have been some studies in the Netherlands showing because their cycling infrastructure is so safe, the helmets might actually potentially pose more danger because of course they're saving you from cracking your skull or having serious brain injuries. But because those are so rare, they could actually maybe cause more concussions or neck injuries just from the mechanism of the fall. It's such a controversial area of research, and honestly, I haven't looked into it so much, but that's why there's not a lot of helmets being worn. I know, it does break my heart a little bit though. And then have countries be able to successfully implement helmets for adolescents and young adults. Oh my gosh, yeah. I don't know what we need to do. I think Taylor Swift needs to wear helmets, and then maybe others will be interested. But I think especially right now, given the state of our infrastructure, it is so important that children and adults wear helmets. There's evidence too that if adults wear helmets, children are also more likely to do it. So just because it's not necessarily mandatory for us, I think it's great for us as people working in child health to try and set that example for the kids around us. Next up, walking and cycling to school actually results in better concentration. I swear I noticed this for myself when I bike to work. There is a really interesting study done in Denmark back in 2012. It was a mass experiment. They do a different one on a different theme every year. And in 2012, they basically had 20,000 Danish students. They asked them how they got to school, and then they had them do various memory and concentration tasks throughout the day. And they found that those who had biked or walked to school had better concentration and better performance on these tasks for even 4 hours after arrival into school. And this really interesting quote is from the scientist who ran the study. For the third grade pupils, if they exercise and bike to the school, their ability to concentrate increases to the equivalent of someone half a year further in their studies. So it can really boost your brain. Next up, walking and cycling to school is better academics. That extra concentration is coming in handy. 10 to 30 minutes of active transportation results in improved perceived academic performance, but also more importantly, improved actual performance when it comes to reading. And this was based on a study of over 30,000 students in Finland. And I see Pranesh Chakraborty has posted a link to the history of jaywalking. Oh, I love this. So jaywalking is a term created by the auto industry. Back in the day, roads used to be shared with people, pedestrians, cyclists, vehicles all together. And vehicle manufacturers obviously wanted their cars to be the most popular method of transportation. So they created this term jaywalking, suggesting that people or pedestrians should not have as much access to the street as cars. But truly, streets were for people beforehand. They really, truly should belong to people. And we should really kind of reframe our thinking so that cars are the guests on the road and not the other way around. And then we have a comment here, weather and winter is a factor, cyclists slipping. Yes, very true. correct clothing to stay warm, not possible for all families. It's true. A lot of merino wool stuff has helped me, and that stuff is extremely effective. I do have some relatively inexpensive-ish interventions for ways to avoid slipping and sliding, though. Now, another way that the built environment impacts our mental health is through the creation of third places. So a third place is essentially not home, which is your first place, and not school or work, which is the second place. Common examples for adults could be like bars or restaurants, for kids, playgrounds, parks, basically any place where you gather and socialize. And this is obviously really key for our development. There was a study of adolescents during the pandemic and found that those who reported more closure of third places that were important to them had worse social connectedness, felt more isolated, and also had worse mental health symptoms as well. I talked a bit about noise before, but noise, and particularly traffic noise, does seem to be associated with worse mental health symptoms. And interestingly, there does seem to be a causal effect, because if people move to a different neighborhood that's less noisy, they do tend to report better mental health. And this is from an Australian longitudinal study of over 30,000 people. There's a different systematic review and meta-analysis of over 30 studies that found aircraft noise in particular tended to increase your risk of diagnosed depression by 12% for every 10 decibel increase in your area. This study found road traffic only had a relatively minor increase in depression, though. Although, ideally we don't live in noisy places that harm our mental health. Air pollution itself, interestingly, seems to put us at higher risk of mental illness. There is a cohort of 1.7 million people in Italy that was followed over about 10 years and found that for each interquartile increase in the amount of particulate matter you're exposed to, your hazard of schizophrenia increased by 7% and depression by 10%. So clearly, pollution is not good for us. Now, I've been talking a lot about the negative effects of our built environments. We can also get positive effects. There's a multitude of studies showing that green space reduces stress. A lot of them have been done in adults. Even just having a window of greenery apparently improves your concentration and creativity. And even having a picture of greenery or landscape can apparently have some small positive effects. I was looking for studies done in adolescents, and this was an interesting one where they basically had adolescents check in multiple times a day with their mental health, and they also gave them a tracker so that they could see where the adolescents were. Now, whether or not your home was in a green space area didn't really seem to affect your stress levels at the time, but as they left home, the more green space in the area where the adolescents were, the lower stress they had. So basically, if you are going to a destination that tends to be more greener, it truly seems to be associated with lower stress. All right, I'll pause here to see if there's any other questions on that link between built environment and well-being. I see some great comments. Continuing on. Okay, great. I'm going to skip over this section on healthcare medical conditions. I will refer you to a great study that was published by Dana Radhakrishnan and colleagues looking at hotspots for asthma in Ottawa, finding that there was some correlation with areas that did have higher needs and were more marginalized. And I was going to talk about it, but it'll take too much time. You can read, hopefully very soon, our study that was just recently accepted for publication in CHEO, the Canadian Journal of Emergency Medicine, looking at differential rates of emergency department visits across Ottawa that showed that they were disproportionately coming from neighborhoods that had higher residential instability, higher material deprivation, and interestingly, were more ethnically homogenous, or for lack of a better term, probably more whiter neighborhoods in the Ottawa context. But I'll skip over those for today. If there's time at the end, we can come back. Now let's talk about the impact of the built environment on our actual communities, because municipal budgets are a determinant of health. There's a great study that was done in 2017 looking at the implementation of bike lanes in New York City and found for basically spending about $1,300 on bike lanes would result in an increase in quality adjusted life years. So for context, in these cost effectiveness studies, a good incremental cost effectiveness ratio, or basically the amount of money you invest per quality of life year gained, is 50,000. So when you're looking at drugs and therapeutics, what's considered to be a relatively good or cost-effective metric is often $50,000 per quality adjusted life year gained. So if bike lanes were a drug, they would be the most popular one on the market. There are interesting studies looking at the effect of bike networks in Guangzhou, China, and Bogota, Colombia, and they found that the creation of these bike networks basically lessened the carbon footprint equivalent to planting almost 400,000 trees, and they paid off for themselves in less than 1 year because of all the economic benefits that come from having people out of traffic, lower injuries. When we look at the carbon footprint, what was really interesting in these two examples in Colombia and China was that the basically greenhouse gas emissions saved from building bike lanes was essentially equivalent to the greenhouse gas emissions that would be created from building highways. So this is one way that we can potentially help save ourselves from our impending climate crisis. Now, here is an intentionally vague and tricky question. Which environment is greener? This kind of more urban environment here, or this more suburban environment with more visible green space? Technically, this is greener, but when we look at which one has more of a drain on our resources and has a larger carbon footprint, it's really important to note that unfortunately, the suburban environments that are low density and car dependent do drain a lot of our resources. This article suggested that suburban expansion in Ottawa cost about $465 per person per year. And that's because it's really inefficient to deliver services in lower density areas. Providing water and electricity is apparently 2.5 times more expensive, and there's a lot of indirect costs from extra traffic and pollution from car dependency. So I've been talking a lot about the benefits of bike lanes and pedestrian infrastructure. As Rasheen identified, sidewalks are not present in all areas throughout the city. And what I wanted to know was, are these benefits evenly distributed throughout our city? Do all of our neighborhoods have equitable access to pedestrian infrastructure and bike lanes? So I found excellent data from a resource called the Ottawa Neighborhood Study. It's publicly available. Anyone can access it. A lot of the data comes from statistics. And it basically looks at over 100 different Ottawa neighborhoods and compares them on various metrics. So I wanted to look at the amount of pedestrian network per 1,000 residents for each of these neighborhoods represented by a dot. So on the y-axis, we have the length of pedestrian networks, which is basically sidewalks and trails per 1,000 residents. And then on the x-axis, we have income level in thousands of dollars. And here we can see that there actually is an even distribution of pedestrian network amongst the neighborhoods, regardless of income level. So that's great. We don't all have access to sidewalks, but it seems like your income is not necessarily a barrier. However, when we looked at cycling networks, so the length of cycling networks per 1,000 residents is on the y-axis. Again, income level in thousands of dollars is on the x-axis. There actually is a clear effect. I did a generalized linear regression and found that for every $1,000 increase in income, you basically had 0.05 kilometers more cycling network. And this was a very significant association. So it does seem as though our cycling resources are disproportionately geared towards the higher income neighborhoods, those who likely are already fairly well off in terms of the metrics where they can help, like physical activity and mental health. So I do think that this is an area of intervention that the city should probably be aware of. Next up, we've spoken a little bit about the impact of the built environment on climate change. I won't go into it because that is a whole talk in and of itself. Ask Curtis Lavoie about it. He'll tell you everything you need to know. Canada does have one of the largest carbon footprints in the world, and you can see that a huge proportion of that is transportation. I always thought that it was just the cost of heating and cooling our homes because we have such a disparate climate. But you can see if we were able to reduce our transportation and make it more efficient, we could significantly reduce our carbon footprint. So there's people in CHEO who are doing just that. So this is an informal study. I basically tracked the number of bicycles in the CHEO bike cage, anywhere from, I guess, 4 to about 18 on these days. The days that have dots are weekends, and the days that have the darker blue shades are evening shifts, where I was going in for a night shift. And then the blue represents basically the daytime. And we can see that there's, a decent number of bicycles in the cage. I want to, of course, acknowledge that not everyone stores their bike in the cage. It's an imperfect metric. There's definitely a few times where I came into CHEO and I forgot to record it. So these data will not be published. But I was curious if we kind of combine the effect. This amounted to about 116 bicycles in those cages on those days. The total trips, if we imagine everyone would be a round trip, would therefore be 232. And if we estimate that on average, people live 5 kilometers from CHEO, that results in a 10K round trip, which means that there is about 2.3 thousand kilometers saved of car trips replaced by bicycle trips. And this reduced the carbon footprint by 300 to 700 kilos. So for everyone who is biking to work, keep it up. We are slowly but surely having an effect. And the reason why it's helpful to encourage people to bike to work, even if you're like, Mel, I live in Manotick, I'm never going to bike to work, this is irrelevant to me. If possible, you want to encourage your colleagues to do it, because on those days where there were 4 bikes in the bike cage, there's this much more space in the parking lot. On those days where there's 18 bikes in the bike cage, this is how much space is saved from our parking lot. It's a lot more efficient way to store our tiny vehicles. Last but not least, because I promised it, a little primer on how to ride a bike in the winter. Everyone can do it. I am a total wuss about the cold. I will not go skiing or snowboarding. I do not find winter sports fun. I will bike. So one thing that helped me is having a fat bike. That's the term for just these bikes with these wide tires. They go over everything. They are a lot of effort to drive because the tires are relatively flat and there's a lot of friction. Honestly, you're probably served just as well by getting kind of a beat up old mountain bike instead. Studded tires can also be incredibly helpful. They really help when you're going over the ice. I personally don't have studded tires on my bike. I just take the turns really slow, and you just got to be careful to not lean into the turns. In terms of equipment for the rider, oh, such an embarrassing selfie, but it's only one I had. I actually use a ski helmet. I don't think that's technically permitted because it hasn't been verified for being safe with biking, but you can get bike helmets that don't have those wide vents at the top that are a little bit more closed and insulated. And those do tend to be really good for keeping the heat in. And the main tip that I have for you is be bold, start cold, because it is tough to ride a bike, especially in the winter, especially if there's snow on the ground. Even if you're relatively fit, you will get exhausted fairly quickly and you will warm up. So if you start super bundled up, you will sweat as you bike, and that will make you cold. So being cold for the first minute or two is a really good strategy. Of course, test it out a few times, make sure you've got some extra equipment. Don't go too far from your house and find the exact equipment that works right for you. But trust me, I am not a paragon of fitness. I am a wimp about the cold. If I can do it, you can do it. Keeping in mind, of course, that there is a lot of privilege that allows me to do this. I'm able to live fairly close to the hospital, I'm relatively able-bodied to be able to do this. I know not everyone can, but if the choice is yours, it is a possibility. And Magda's saying first 5 to 10 minutes in their opinion. Also a good tip for cross-country skiing. Yeah, exactly. Probably a good tip for all winter sports, but I otherwise don't go outside in the winter. The biking has improved my approach to winter riding. So at this point in time, we've got about 10 minutes left. I'll quickly show you, there are so many references for this presentation. I'll quickly skim through so that if you want to screenshot anything on the YouTube recording, you're more than welcome. Here's an acknowledgement for the photographers who allowed me to use their photos for this presentation. And at this point, we now have 10 minutes for just conversation, questions, reactions. I'd love to hear about in your clinical environments where you see the connections between the built environment and child health. Do you have questions about where to take things next?
Great job, Melanie. That was very nicely done. I one small complaint, I've been biking all year for 30 years and I still can't focus, but I guess that's just, but I just want to echo what Magda said and you said and Kurt said. It really is the best part of the day, and it's amazing how if you bundle up, you can do it. Plus, if in the winter you can tell your wife there's studs on the tire and one on the seat. That's she loves that too.
It's worth it for that joke in and of itself. That's great. Thanks, Alex. Yeah,
Okay.
see, I think even when I started biking to and from work in the summer, I was still very reluctant to do it in the winter. I was like, oh, that seems absolutely insane. But I just kind of one year decided to keep biking until I got too cold to do so, and just progressively put on more clothing and realized like, hey, this is actually fairly doable. And it is kind of cool. The biggest risk is that it does become your whole personality and you will not stop talking about it. So do need to be aware of that.
Yeah, no, my friends make me aware repeatedly. Yeah, shut up. We know you biked in.
Heather,
Are there other questions? I could go on forever. I don't know.
Heather has a question here. You can
great.
help address this as well, Alex. How long is your commute to CHEO? So my commute is about 6 kilometers. On my regular bike during good conditions, I can make it there in like 20, 25 minutes. During the winter on the fat bike, especially if there's a lot of snow, it takes me like 35 or 40 minutes. I'm really, really slow. But that's my distance. I don't know. How long are you coming from, Alex?
8 kilometers. So 8 kilometers.
8 kilometers. There you go.
So we are not Oslo. We do not have the Norwegian oil money that they can put everything underneath the ground, etc. I mean, it was a perfect storm of tons of money and just very sensible people. So what are the top 1 or 2 things you would do if you were the Mark Sutcliffe or something that would address, say, accidents? Can you see at the top?
Great question. Yeah, I think first I would fund our public transit appropriately. We're a big enough city such that we need appropriate public transit, and the poor O train is, I think, arguably even worse than the dedicated bus lanes and networks that we had before, because I think that would introduce a meaningful modal shift. And then creating a true cycling network. So we talked a lot about bike lanes, but creating one lane on a street that's just surrounded by other areas with no cycling infrastructure obviously isn't as effective as creating like a coordinated network and looking at where people actually want to go. And again, we do have evidence that, yes, it is expensive to build these, but when you factor in the reductions in traffic, reductions in pollution, the reductions in road maintenance, because roads last a lot longer when there's fewer cars on them, the healthier population, it actually is cost effective. You can save money in the long run. It just takes political courage to spend money on something that won't have payoff immediately. And that's what I think I would like to do if I were ever in that position. I see a comment here from Toby about the Rideau Winter Trail, which is an amazing trail that's maintained in the winter for fat bikes and skis.
Yeah. Toby has a question too. Keep your hand up.
Oh, please go ahead, Toby.
This is an amazing talk, Mal, and thank you for all of the great evidence. I love the idea of rethinking how we support kids getting to and from where they need to go and us getting to and from work. Any thoughts on other things that we might do to kind of leverage for ourselves or for our patients some of the things around the CHEO campus? One of the things that's often struck me is, we do actually have like a beautiful campus that is surrounded by some green space and maybe we don't leverage that enough in terms of the nature prescribing that we do with our patients. I know Dr. Zar, who may or may not be on these rounds, he was at the last Crown Towns and has really been involved in nature prescribing, but wondering whether there's other things we could be doing to leverage that on our site as we're sort of thinking about the rebuild and the big redevelopment.
Yeah, great question. Nature prescribing is really interesting. There's great work from Dr. Melissa Lem out in BC and Parks Canada, which is essentially a nature prescribing initiative where families have actually been able to get compensated access to Canada's parks throughout the summer if physicians do write them a script, because it does have those clear benefits. At CHEO, we probably could do a lot more to get outside. I know we did that outdoor yoga class together in the summer, Toby, and I don't know, that made my week. It was really lovely, both for the patients and for healthcare providers. We do know that just being in a green space does kind of immediately result in stress reductions and well-being. I do think that our CHEO campus is pretty good. We have a pretty decent bike cage. Ideally, it would be covered so that the bikes aren't covered in snow. One issue that I ran into last year cycling during the winter was that the path to the bike cage was not plowed. But I spoke with Curtis Lavoie about it, and he actually connected with the folks in maintenance, and the bike cage was usually plowed after that. It wasn't 100%, but I think really making sure that the infrastructure we have is supported to be used all year. And we should really install some protected bike lanes throughout Ring Road. We do have some on Hospital Link Road, which are great, but I do think that we have the potential to be a leader and to kind of show what this looks like. And then beyond CHEO, there's a lot of power in pediatricians and our stories. And I do think that we could probably liaise more with the decision makers in the municipality. I'm hoping to save this presentation and maybe even share it with my local councillor representative to see if he thinks it would be useful to anyone at the city, because they know the data and stats, but having providers who have cared for children who have suffered injuries from our roads, I think is a lot more compelling. I do see Batra has a question as well too.
Yeah, can you hear me now?
Yes, loud and clear.
Yeah, thank you very much. Now, my question is regarding, okay. Yeah,
There's an
my
echo,
question is
but I can hear
regarding
you.
the walkers and the drivers. When I'm driving, I see some people walking in the same direction. Other people are walking in the opposite direction. The common sense would say that the people who are walking in the opposite direction will be more safer. But I wonder if you have any statistics showing that the people who are walking in the anti-direction are more safe than the walk in the same direction.
Oh, good question. I've wondered about that myself, but I truthfully don't have any statistics around which approach is safer. Yeah, sorry about that. I have to look into it. And I see more commentary from Jeff Gilchrist. If you live farther away, e-bikes are great to cover distance. Absolutely. E-bikes can be car replacement, especially if you get a cargo e-bikes, kind of like some of the ones that were pictured when we're speaking about the Netherlands. Yes, and thank you for pointing out the privilege. Yeah, a lot of these are really expensive. It's not realistic for lower SES families. There's a huge environmental justice component, which I would have loved to make a bigger part of this presentation and only kind of touched upon a little bit. But, you know, I think that sometimes biking to work is seen as something virtuous, but really it's something a lot of us are able to do from privilege. And I think using that position of privilege to try and encourage and make it safe and accessible for as many people as possible is key. Oh, that's interesting. I don't know if there's data to show that winter bike riding is more dangerous. That didn't come up. I think it's still a relatively new and understudied thing, particularly in North America. It's really interesting. In certain countries and communities, there's a town called Oulu in Finland. If you Google it, it's famous for being a winter cycling destination year-round, and there's tiny children on bikes in the snow. No fat tires, no studs. They just kind of learn from an early age how to like bike and balance on the ice and snow. And they have at it. So at least in those settings, it's worked well, but I don't know of any studies in Canada that look at the comparative risk of winter biking. Okay. And then Magda and Stuart are kind of talking about what they think might be the law and what's permitted for which side of the road to walk on. Oh, has there been any advocacy on how we can maintain our local natural environment to help families who've been admitted? I think that would be really key. There's interesting studies, and I didn't look into them, but they came up in my lit search about how there's apparently faster healing, less complications if people in the ICU even have a window looking out to nature. The power of nature, even just in rough proximity, is really interesting.
Thank you. I'm going to have to, it's 9:30, our time is up, but that has been a really amazing presentation with a really great discussion. And I think it's one of our best virtual discussions that we had. So thank you, Melanie, for your excellent talk, and also for your, for bringing all these really important things forward. So it's been a really great talk. So thank you again. And thanks everyone. Have a great day.
Thank you so much, Donna, and thanks so much everyone for participating. It makes it so much more bearable.